From the podcaster. Powered by Timber Media.
Dr. Manohar KN is with us today to help us understand the new coronavirus and COVID-19, which is the outbreak. He's a consultant physician and diabetologist with Manipal Hospitals. One important aspect of understanding how to prevent COVID-19 is understanding how it really spreads, doctor. So if you could tell us a little bit on the spread of coronavirus and who is vulnerable to contracting an infection.
Yeah. So this coronavirus, like the influenza virus, is a respiratory virus. So it attacks the respiratory system. So the spread is directly by the droplet spread.
Okay.
So when you cough or sneeze, the droplets get sprayed in the air and the virus particles are engulfed in the droplets, and when it falls on your mouth, nose, eyes, it can get transmitted from one person to the other.
Right.
This is a direct spread. The indirect spread is when someone has coughed or sneezed, the virus particle can stay on the surfaces like desk, chairs, door handles, etc. And it can survive on these hard surfaces for a few hours. I think that a lot of timeline is changing, but definitely it all depends on what sort of a surface it is and what is the temperature.
Right.
So on these surfaces it stays and it's not visible, and people in their movement they keep invariably touching the desk, files or the door handles, and after that unknowingly we keep touching our face, mouth, and then it gets transmitted to the other person.
Right.
The more scarier spread is, so this is all about droplet spread. The more scarier spread, what we are thinking nowadays is whether it spreads to aerosols. Aerosols means because of this bout of cough or sneeze, the viral particle floats in the air and spreads from one person to the other.
Right.
So this will become a huge problem in crowded situations and also for the healthcare professionals when they're trying to do procedures on the sick patient.
Right.
So this aerosol spread is gaining some momentum. We definitely know it is droplet spread, and maybe aerosol, at least for very close contact and healthcare professionals, that becomes very important. So these are the two main ways of spreading it.
Okay. So now the next part of the question is, who are the people who are most susceptible to getting infected by the new coronavirus?
Yeah, the most susceptible are the elderly individuals.
Okay.
People above 65 are at the highest risk and highest risk of succumbing to the coronavirus infection.
Okay.
The other group of people who are already having medical issues, like someone is on cancer treatment, dialysis treatment, hypertensives are at more risk, even diabetics are at risk.
Right.
Special population is hypertension, which is a bit surprising as opposed to the other viral infections. So hypertensives also should be careful. And pregnant ladies definitely should be careful. Fortunately, this is not so much of a problem with the younger people.
Right.
So the kids, the data says that the incidence is quite lesser. Nevertheless, we should be very careful. So the extremes of age, especially on the older side, and people with pre-existing medical conditions like malignancies or cancers and hypertension, diabetes, asthmatics, who have other lung issues, are at higher risk. And more importantly, the behavioral risk is important. That's why the people who are in the crowded place, and of course people who care for the sick, like hospital staff, nurses, to drivers, to lift operators, whoever is employed in the hospital. So the ward boys are at much higher risk as opposed to the general public. That's why the social distancing and quarantine becomes very, very important.
From the podcaster. Powered by Timber Media.